Hello nurses, welcome to a new video. Today we are going to see MCQs on newborn resuscitation. So those who have already attended some ACLS or BLS training program or newborn resuscitation program, or those who are preparing for any kind of nursing exams, these are a few ultimate nursing, newborn resuscitation MCQs for any of your exams. Let's start now. The first question: what is the first action on starting resuscitation of a newborn baby? Option A: follow ABC approach. Option B: commence chest compressions. Option C: dry and cover the baby. Option D: initiate PPV. And the right answer is option C: dry and cover the baby. Providing warmth is the first step. Question number 2. What percentage of babies need some form of resuscitation immediately after delivery? Option A 1%, option B 10, option C 25, option D 0.5%. And the right answer is option B 10% of babies need some form of resuscitation immediately after delivery. Question number 3. As a nurse, you know that sodium bicarbonate and adrenaline 1:10,000 through an umbilical venous catheter be administered during resuscitation of the newborn infant to reverse option A respiratory acidosis, option B volume depletion, option C intracardiac acidosis, option D vasoconstriction. And the right answer is option C, intracardiac acidosis. Question number 4. Birth asphyxia contribute to what percentage of newborn death every year? Option A, 10%. Option B, 20. Option C, 30. Option B, 40. And the right answer is 20% of birth asphyxia contribute to newborn death. Out of the total newborn birth, 20% is by birth asphyxia. During delivery of a preemie mother of 42 weeks of gestational age, the nurse notes pea soup-like amniotic fluid with visible meconium. What is the expected step of resuscitation? First step of resuscitation. Option A, dry the baby. Option B, suction the hypopharynx. Option C, assess Apgar score. Option D, cord clamping. And the right answer is, here meconium is there, so option B, suction the hypopharynx. Question number 6. A preterm born at 30 weeks of gestation following a complicated PIH pregnancy induced hypertension. What is the most important initial management? Option A, assess transcutaneous oxygen saturation. Option B, keep under warmer. Option C, start PPV. Option D, start nasal catheter oxygen. Nothing else is mentioned about the baby here, just mentioned that it's a preterm baby. So warmth is the first step. Keep under warmer. Question number 7. During neonatal resuscitation, what is the order of clearing the secretion? Option A, mouth and nasal cavity simultaneously. Option B, nose first and then mouth. Option C, mouth first and then nasal cavity. Option D, nasopharynx deep suction. And the right answer is option C, mouth first and then the nasal cavity. Question number 8. Which limb is preferred in newborn to check transcutaneous oxygen saturation? SpO2 generally checked in which limb of the newborn? Option A, right upper limb, right lower limb. C, left upper limb. D, left lower limb. And the right answer is right upper limb is the preferred site for checking SpO2 in newborn. As a nurse, you are aware that the most effective communication among healthcare team during resuscitation is therapeutic communication, open-ended communication, close-ended communication, closed loop communication. And the right answer is option D, closed loop communication. That means if anything in the resuscitation team, suppose if the doctor is asking you to give 1 dose of adrenaline, immediately after giving, you have to give the feedback that I have given this much of adrenaline followed by this much of flush. So that is called a closed loop communication. Every communication should be like replied or responded. Even just doing the action is not completing it. Doing the action and also reporting it that I have done this is called a closed loop communication. This is very much important during resuscitation. Question number 10. Delayed cord clamping done at option A 1 to 3 minutes, option B 3 to 5 minutes, option C 3 to 6 minutes, option D 2 to 5 minutes, and the right answer is 1 to 3 minutes. Question number 11. A pregnancy complicated with uncontrolled gestational diabetes mellitus and eclampsia had to be terminated at 33 weeks of gestation. Newborn looked dusky, gasping with heart rate less than 100 beats per minute after a minute of delivery. As a respectful maternity care team member, the nurse knows that the next step is option A, assess SpO2 and provide oxygen. Option B, keep under warmer. Option C, open airway, suction and consider CPAP. Option D, initiate positive pressure ventilation. And the right answer is option D, initiate positive pressure ventilation. Remember, these are very important when you consider newborn resuscitation. It's based on the breathing as well as heart rate. And if the heart rate is more than 100 beats per minute, but still if it is associated with breathing problem, actions vary. So if the breathing is regular and heart rate above 100 beats per minute, routine care only is needed. And if the heart rate is 100 beats per minute but labored breathing is there, you need to check the airway, suction, and also consider CPAP if it is a preterm baby. For such babies, SpO2 monitoring is very important. If the baby is cyanotic or look little dusky but still the heart rate is above 100, then you need to continue monitoring SpO2, and also now you should consider giving oxygen if required. But remember, if the baby is apneic or gasping, also the heart rate is less, you need to start PPV. Remember, gasping and apnea are different. Apnea is total cessation of breathing, right? But still, gasping is considered equally dangerous to apnea or equal to apnea, especially in case of newborn resuscitation. This is very, very important. Question number 12. Targeted preductal SpO2 of 95% is expected to achieve by the newborn after how many minutes? Option A 1 minute, option B 3 minutes, option C 5 minutes, option D 10 minutes. And the right answer is option D 10 minutes. Remember, these are the targeted preductal SpO2 after birth. What is expected? In 1 minute, 60 to 65% of SpO2 is fine. After 10 minutes, 85 to 95% of SpO2 is expected. Question number 13. Immediately after delivery, the baby not cried and the nurse knows that the initial steps for this baby do not include option A, suction, option B, dry and discard the wet linen, option C, stimulate by rubbing the back, and option D, provide oxygen. The right answer is provide oxygen. Remember, even if the baby did not cry immediately after delivery, the first minute we will be doing the initial steps which do not include oxygen. The initial steps are warm DSPs. That means provide warmth, warm for warmth, and D for dry and discard the wet linen, S for stimulate the baby by rubbing at the back, P position the baby, S suction to clear the airway. After this initial resuscitation, even if the baby is not crying in a minute, then you have to consider the next steps. Question number 14. After initial steps of resuscitation, if baby not breathing, what step is initiated? Option A, chest compression. Option B, intubation. Option C, PPV. Option D, CPAP. And the right answer is option C, PPV. Remember, in newborn resuscitation, this is considered to be a gold standard. Even if you are not able to establish or put an ET tube, you are waiting for some expert to come. Till then, you can continue PPV. PPV is a very important or the most important step of newborn resuscitation. What is the right position to give PPV from the following pictures? You can see three different pictures, and if all the three are right, you can choose the option D, which is all of the above. And the right answer is option A. The provider should be standing at the head end of the baby. Even if you're providing PPV or chest compression, that is the ideal position. I mean, ideal way to give the PPV or chest compression. But remember, if PPV or giving bag and mask, along with that chest compression also given, two people are there to resuscitate. In that case, the chest compression providing person will be at the head end. That time, the PPV providing person will be at the side of the baby. Only in those case, the person provider will be standing. Otherwise, it's usually the preferred site is at the head end of the newborn. Question number 16. What are the signs of effective PPV in a newborn? Option A, rise in heart rate. Option B, good chest movement. Option C, improved color and muscle tone. Option D, all of the above. And the right answer is all of the above. The same question, similar questions we have also discussed in our adult resuscitation. If you haven't watched the MCQs of adult resuscitation, please do watch. Question number 17. How often heart rate to be assessed during PPV of a newborn? Option A, 1 minute. Option B, 30 seconds. Option C, 2 minutes. Option D, 3 minutes. And the right answer is option B, 30 seconds. Question number 18. How to measure the length of ET tube insertion in newborn? Option A, nasal bridge to tragus of the ear to midway between the umbilicus and the xiphoid process. Option B, NTL, that is nasotragus length plus 1 centimeter. Option C, weight of the baby in kg plus 6 centimeter. Option D, both B and C. And the right answer is both B and C. A is actually the length of orogastric tube. Before the insertion, you will be measuring the length by doing the steps. Nasal bridge to the tragus to midway between the umbilicus and xiphoid. Why nasal bridge is usually nasal tip only we say, but if PPV is being provided, then the nasal tip won't be visible. That's why nasal bridge is considered to be the site. Question number 19. When the newborn is not revived after PPV and endotracheal intubation is considered before chest compression, not more than how many attempts of ET intubation can be tried on the newborn? Option A, 2. Option B, 3. Option C, 5. Option D, 6. And the right answer, only 3 attempt. Option B, 3. Question number 20. Neonatal resuscitation guidelines ratio for compression ventilation is option A, 3:1. Option B, 1:3. Option C, 2:3. Option D, 30:90. And the right answer, 3:1. The required adrenaline dilution of adrenaline and amount of flush for newborn resuscitation is option A, 1:1000 and 1 ml of flush. Option B, 1:10,000 and 3 ml of flush. Option C, 1:10,000 and 1 ml of flush. Option D, 1:100 and 2 ml of flush. And the right answer is option B, 1:10,000 followed by 3 ml of flush. Question number 22. In case of failed venous access, the ideal route of administration of adrenaline during resuscitation is option A, intracardiac, option B, intramuscular, option C, subcutaneous, option D, endotracheal. And the right answer is option D, endotracheal. If you are not able to get the venous access, and it's taking time and the baby is already intubated, you can give through the endotracheal tube. Remember, through the pulmonary vasculature it will get absorbed. Question number 23. Rapid IV bolus to be avoided in preterm babies to prevent. Option A, necrotizing enterocolitis. Option B, peripheral vessel injury. Option B, intracranial hemorrhage. Option D, respiratory distress. This is one important complication. Option C, intracranial hemorrhage, if you give rapid IV bolus in preterm babies. Question number 24. Maximum pressure that can be delivered with a self-inflating bag during PPV as part of newborn resuscitation is. Option A, 15 centimeter of water. Option B, 25 centimeter of water. Option C, 30 centimeter of water. Option D, 40 centimeter of water. Maximum pressure is 40 centimeter of water. Question number 25. Site of checking newborn pulse during resuscitation includes femoral, option B brachial, option C umbilical, and option D all of the above. The right answer is option D all of the above. Question number 26. After 30 seconds of ET tube inhalation and 1 minute coordinated chest compression, the heart rate of the newborn is 48 beats per minute. Next step in management is administration of epinephrine through option A, peripheral line in the right hand, option B, peripheral line in the left hand, option C, IV in the lower leg, option D, umbilicus venous catheter. The right answer is option D, umbilicus venous catheter. This is considered to be the important venous access for the newborn during resuscitation. Question number 27. Mother received injection morphine 1 hour before delivery and the baby did not cry spontaneously after delivery and does not improve with stimulation. What is the most appropriate next step? So mother received some narcotic. Option A, start chest compression. Option B, administer opioid antagonist. Option C, start continuous positive airway pressure. Option D, start positive pressure ventilation. And the right answer is start PPV or positive pressure ventilation. Question number 28. A successfully resuscitated baby on ventilator support started deteriorating suddenly. As the primary care nurse, you should be aware about the following possible most common reason for post-intubation hypoxia. Option A, pneumothorax. Option B, equipment malfunction. Option C, displaced ET tube. Option D, any of the above or all of the above. And the right answer is any of the above. So remember, the most common causes of post-intubation deterioration or hypoxia can include either the displaced or dislodged ET tube or any obstruction of the ET tube, which could be due to secretions or mucus plug. Pneumothorax is another important reason. You can confirm it by doing a chest x-ray. And another thing is equipment malfunction, which could be related to ventilator or ventilator tubings or any connections. Question number 29. Following PPV, a newborn deteriorated with the development of pneumothorax. As an ICU nurse, you know that the most preferred site of aspiration in this case is option A, fourth intercostal space anterior axillary line. Option B, second ICS mid clavicular line. Option C, sixth ICS anterior axillary line. Option D, both A and B. The right answer is option D, both A and B. Remember, for newborn pneumothorax aspiration, the most preferred sites are either fourth intercostal space in the anterior axillary line or second intercostal space in the mid-clavicular line. Question number 30. A preterm newborn with heart rate of 40 beats per minute whose chest is not moving post intubation and ventilation. What is the ideal next step? Option A, remove ET tube and continue PPV. Option B, rule out pneumothorax. Option C, suction airway. Option B, start chest compression. And the right answer is suction airway. First, you need to see if there is any obstruction. Is that the reason why the baby is not improving? After ruling out that, then you can think about removing the tube or finding out the pneumothorax. Thank you. With that, we complete the newborn resuscitation MCQs. Please review the MCQs and prepare well for your exam. Thank you very much.